Hello, everybody, and welcome to our FSPSA Stakeholder webinar. This webinar is focusing on the Family First Prevention and Services Act and related issues, and our Associate Commissioner, Christine Blackstone, will be our presenter. But before I turn it over to Christine for the presentation, I want to go over a few things with you. A few ground rules for today's webinar. You can submit your questions, any questions that you have during today's webinar via the question tab on your control panel, and we'll do our best to answer as many questions as we can in the time that we have. If you have questions after the webinar or we run out of time and can't get to all the questions, please email the questions to me at valinda.bolton@dfps.state.tx.us. We will also be archiving this webinar, as we do with all of our stakeholder webinars, on the DFPS website for those who aren't able to participate today or who want to go back and look at it for reference. Additionally, we are able to offer closed captioning for the first time with this webinar. So you'll see on your screen the link to be able to access the closed captioning that will go hand in hand with the PowerPoint presentation. We also sent an email out to all of the registrants this morning with a link, this same link, to the closed captioning, so you can access the link there as well. So at this time, I'm going to turn it over to Christine, and we'll begin our presentation.
Okay, good afternoon, everyone. Thank you for joining us today. I'm really excited to have a chance to talk with you about Family First Prevention Services Act. Today I have with me someone else. Her name is Stephanie Ridgeway, and she is our Family First Protection Services Act specialist here in Texas. And so I just wanted to take a moment to acknowledge her. And just so you know, if you're going to email her, her last name is Ridgeway, but it's R-I-D-G-W-A-Y. So that's really exciting for us. Stephanie did some of the same work up in Kansas, and so she brings a little experience from another state to the table. We're really excited to kick off our informational webinar on FSPSA. We hope to explain what the bill is and to set the stage for future discussions with stakeholders across the state as we develop plans to take to our state leadership with recommendations regarding how FSPSA might best be implemented in Texas. So we'll start off with what is FSPSA. The Family First Prevention Services Act passed in February of 2018, and it's important to note that it was part of the budget bill. So while FSPSA has very important goals and reimagines child welfare, it is ultimately a budget bill. And what that means is it changes how federal 4E dollars can be spent. Today, 4E dollars are primarily spent on foster care and the back end once children have been removed from their homes. What FSPSA does is allows us to spend child welfare federal dollars on the front end, preventing children from entering the foster care system. So the ultimate goals and outcomes that FSPSA aims to improve are for four populations: children who are placed in congregate care. And by congregate care, we mean typically here in Texas would be emergency shelters or residential treatment centers. Aims to improve services and outcomes for kinship caregivers and the children that they care for parents who struggle with substance abuse and their children, and for children who are at imminent risk for entering foster care. And you'll see there our definition of children in imminent risk. This is the state has always had a definition for children in imminent risk for entering foster care, and it's something that we already currently document. Children who are at imminent risk are children, anytime a child is the subject of a safety plan and absent preventative services, the plan is removal. And a child who may not be the subject of a safety plan, but scores out on our structured decision-making risk assessment tool as being at high or very high risk for future abuse and neglect. These kids you'll see in our current definition are children who primarily in Texas are served through our family-based safety services stage of service, or as some people may know it, in-home cases. So those are the populations that the services are targeted to. We'll talk a little bit more about that as we go forward here. It's important to note one thing, and I'll be speaking to this in a little more detail, but what I think one of the fundamental things here is FSPSA services must be evidence-informed in some way, and we'll get into those details. They must be evidence-based and trauma-informed. And so as we think about this kind of new roadmap, that's an underlying foundational thing. But the actual goals and outcomes that FSPSA is aiming to change are they want to see states decrease the use of congregate care settings, prevent additional entries into foster care, encourage and support CAM placements, elevate the quality of prevention services, and allow children to be placed with their parents in treatment facilities. So these are some new opportunities for us to change the way we're doing business, to use federal dollars differently, and to achieve some of these outcomes, which is the purpose of the federal law. So in Texas, in November of 2018, we notified the Administration for Children and Families that we intended to delay our implementation until September of 2021. And the primary underlying reason for this is after the bill came out, the Fed started issuing guidelines and instructions, and it's taken some time to work through those and do the underlying analysis that was needed to start charting a path forward. And now we have a lot of work to try and start designing how we would implement FSPSA. And so we're currently have engaged in a program, legal and fiscal analysis, and we've begun engagement with our stakeholders. Primarily, at this point, we started our engagement with our service provider community, and I'll speak at length about our community engagement strategy towards the end of the presentation. Then also during the legislative session, we had two important bills that address some of the underlying tenets of FSPSA, and those are Senate Bill 355 and Senate Bill 781. Senate Bill 355 addresses the components of FSPSA that are associated with the preventative services and really has us developing a plan for how we would recommend implementation of the preventative services that Texas could draw down federal dollars for under this act. And then Senate Bill 781, which is having to do with congregate care here in Texas, has us developing a plan and doing an analysis associated with the use of qualified residential treatment placement that's a part of this bill that we'll speak more about. So those two bills both have the department developing a set of recommendations and strategies for implementation of things associated with FSPSA. And those plans are due to the legislature on September 1st of 2020. So what we have done thus far is develop an action plan that lays out all of the steps that we're going to need to take in order to develop the strategic plan and recommendations for the legislature. There are required provisions in FSPSA that all states must do. So some of FSPSA is what you ought to do. Some of FSPSA is what the federal government will and won't pay for in the future, but there are certain required provisions of FSPSA, and those are listed up on your screen. The first one having to do with our electronic system, an electronic system for the interstate placement of children. And what this system would do would more easily facilitate the placement of children in other states around the country and from children from other states into Texas. So we currently use a manual process, which is very burdensome due to the large number of placements that must be coordinated both in-state and out-of-state. And there are a few states that are already on this electronic exchange, and everybody really wants Texas to join because we're such a big state. This required provision isn't required until 2027, but there was a grant opportunity for a grant fund that would allow the state to build the NIST system more quickly than waiting for that required timeframe of 2027. And we have applied for that grant, and we expect to hear about it very, very soon. The second provision is the creation of a statewide fatality prevention plan. Texas has maintained a statewide fatality prevention plan for several years, and we believe we are already in compliance with this particular provision of FSPSA. The third required provision is that we establish protocols to prevent inappropriate diagnosis and ensure appropriate placements. We currently in Texas, as many of you on this call are aware, utilize Youth for Tomorrow, an independent contractor, to evaluate and assess and set service levels for our children. And so we believe this protocol meets this particular provision of the bill and that we are in compliance on this piece as well. And one of the reasons we know that is we've had other states reach out to us and contact us because they've been directed to learn about what we already do here in Texas as a potential path forward for FSPSA in their state. Next up, there's requirements associated with the abuse and neglect background checks for caregivers for children in substitute care. We are currently in communication with the feds about what's in place here in Texas and our standards and our rules. So there's communication going back and forth, but in general, we believe we're in compliance with these guidelines as well. Lastly, there are some federal foster care model licensing standards that have been released. The states have had an opportunity to comment on these standards. They do deviate from some Texas standards, but we would have the opportunity to submit a waiver and ask that our existing standards be approved, or we might adopt some of the standards that we don't have today. So that's an area that we still need more further exploration around. So this is the big opportunity. What FSPSA does is allow states to use federal matching funds. So note thus that the state would have to pay for 50% of these services, and the feds would put down a 50% match. But it allows us to use federal funds for evidence-based prevention treatment services associated with mental health, substance abuse, and intensive in-home parenting skills building. Services are allowable for up to 12 months, and there's no time limit on how often a family, if the family were to come back into need for services in the future, they would be allowed to do that. But note that with these new federal funds and this new opportunity, there are, of course, new reporting requirements to the feds. And one of the tasks that we're undertaking is determining what changes, if any, would need to be made to our impact system in order to meet the guidelines set forth in the reporting requirements. So the services that we can purchase that will be associated with mental health, substance abuse, or parenting skills training must be evidence-informed, as I mentioned earlier. So they must be well-supported, or promising practice. And the studies have to have been evaluated, and the state must continue evaluating. And those are the types of evaluations that they envision to support that a program or an intervention is well-supported, supported, or promising are either randomized quality trials, randomized control trials, or a quasi-experimental design. So those are the two things. There have been 12 programs removed, 12 programs reviewed, and there is a list that we are going to post to our website. But I know there's service providers on the phone, so I really want to cover this. The currently approved services and programs for mental health include functional family therapy, multisystemic therapy, parent-child interaction therapy, and trauma-focused cognitive behavioral therapy. So those practices have made the clearinghouse. In the field of substance abuse, families facing the future, multisystemic therapy, and methadone maintenance programs have all made the clearinghouse. And for in-home parent skill-based programs, Healthy Families America, the Nurse Family Partnership, and Parents as Teachers have all made the clearinghouse. There have been no Kinship Navigator programs approved at this time. There were 2 Kinship Navigator programs that were submitted and evaluated in the first round, and neither of them made the cut as an intervention that will be allowed under FSPSA. There are currently 21 additional services waiting for review, and we're really excited about one of these because they are reviewing the Nurturing Parent Program. And in Texas, we, a few years ago, started training our staff. We trained a small set of our staff, a unit in Region 1, or unit in Region 4, one in here in Central Texas, and one in the Region 8 on the Nurturing Parent Program. It's an evidence-based intervention. We trained our caseworkers on how to deliver it. Additionally, as many of you know, we have a family-based safety services pilot where we have outsourced case management in El Paso, in the El Paso region, to a family services contractor called HomeSafe, and they too chose the Nurturing Parenting program as an intervention to train their staff on. So it's a program that many of us here in Texas have been working with our child welfare involved families under that model, and so we're excited to see that it's being reviewed on the list at this time. I want to note one other thing here about these services. These services are not all services that CPS pays for today. Primarily when we access parenting skills and parenting coaching, with the exception of what I just described, the Nurturing Parent Program, we are getting those through community resources across the state. There are well over 300 entities who deliver parenting coaching or parenting training that our caseworkers access out there all across the state. And we, in partnership with Casey Family Programs, as well as the Texas Alliance for Children and Family Services, have been are engaged in a survey to determine the types of intervention that those programs are utilizing right now, so that we can determine where we are in terms of programs that might be able to be considered for the clearinghouse or may already be in the clearinghouse. And then I'll just note one other thing about this. So you'll notice the services must meet well-supported, supported, or promising ratings. They expect that 50% of the state spending will be on well-supported programs. All right, and this is where we talk about the congregate care aspect of Family First. So right now we pull down $4E for children that are 4E eligible for whatever type of placement that they may be in. So federal match would continue for certain placements, but not all placements. The type of placements that you would be able to get your 4E match for are placements that take pregnant and parenting youth, supervised independent living, specialized placements for children who are victims of or at risk of becoming victims of sex trafficking, foster family homes with no more than 6 children in foster care, and then high quality congregate care, or QRTP. That's qualified residential treatment placement. And we'll talk a little bit more about those. Otherwise, the feds will allow for 2 weeks of spending, 2 weeks of a child being placed in some other type of placement outside of these, say for example, an emergency shelter. And you could, Texas could draw down $4E in order to pay for placement in an emergency shelter, but just for 2 weeks for any child. So it's also important to note that when the state goes live with FSPSA, as we will on September 29th of 2021, that the children that are currently, whatever placements children currently are in, their grandfathers in, and it's just as they make a move or as a new child comes into care that these particular provisions would apply in terms of what the federal matching is eligible for. So let's talk about QRTP. So QRTPs, imagine a clinical, some people say quasi-medical or medical model of residential treatment placement. In order to get federal reimbursement, you have to have an independent assessor who says that the child needs such a placement. It requires approval by the court. A review has to be done every 6 months to determine that the child still needs that type of placement setting. The trauma-informed treatment model, there must be nursing or clinical staff, engagement with the family, and this is a really big piece here, the provision of at least 6 months of aftercare after a child discharges from the residential treatment placement. That's not something that is a service that we purchase today in Texas. It's not part of the model for residential treatment, but that is a really big change. It's to provide support for children as they transition out of residential care to allow them to be successful in those transitions. And then the placement must be, of course, licensed, but also accredited, and that's not something that's required today in Texas. So there's two real big components in terms of what the service provision looks like, which is that aftercare component and then that accreditation component. And then on the upfront end, that court approval and that independent assessment. So we are beginning to engage the provider community. For any residential treatment providers who are out there, I'm going to give a little advertisement at the Texas Alliance of Child and Family Services Conference coming up on September 30th in San Antonio. I'll be doing a workshop to start talking with providers about accreditation and the QRTP model and hearing from our residential treatment provider community about what it would take, what they feel it would take to move to a model like this. And so those conversations are starting, and we'll be very interested to engage our provider community on this subject. So this next slide is just at a glance for you about where we are with the different components of the model. And so as I mentioned earlier, some of the things are optional. If Texas decides that, if our leadership decides that we want to purchase prevention services, then we can, and we can put down a 50% match, and the feds will match it at 50%, but we don't have to do that. Same with the substance abuse, kinship navigator, and mental health services. So you kind of can get a sense in there of the various things that are optional and the things that we are going to have to do. And see also where we are in compliance already. So at the outset, I mentioned that one of the goals of this bill is to provide support to families to reduce removal of children and placement into the foster care system. It's allowing money to go to that front door, front end, rather than waiting for children to come into foster care to spend Title IV dollars to help families. So, but I think it's important to note when we're talking about FSPSA that Texas has an extremely low removal rate. Nationally, removals are about 5.7 children per 1,000 children, and we are well below that, as you can see on the slide. We have also been working diligently to reduce the number of children that are placed in congregate care in Texas over the past 10 years. We've had about a 5% decrease. That's small but important, and I think we'll continue to make inroads on that as we go forward, and I'll talk about some of the things that we're doing to push forward on that as we go. And then in Texas, we have a very high number of kids that are placed with kin at any given time. It's usually around 45%. So just to think about all of the opportunities that FSPSA offers, it's important to think about them in the context of what's already been going on here in Texas. because I really feel that Texas has supported the goals of FSPSA, that we've been moving towards these same goals for quite some time. And that's why I wanted to provide that data that was on the previous slide. And you'll note right away here, 87% of children in the Texas foster care system are in family-like settings of some sort. And as I mentioned, we are working to reduce our use of congregate care. And I think there's two main ways that we have been doing that. And number one has been the increased use of kinship placements, but two, the development of things like community-based care to address capacity issues and promote development of family-like settings for children closer to their home communities. And then secondly, treatment foster care, which really in Texas, our model for treatment foster care has been aimed at children who are at risk of entering residential treatment. In some states, treatment foster care is used for children stepping down out of residential treatment as a way to help them successfully transition into less restrictive environments. But our model here has been to target a little bit younger age group kids with the notion that we can prevent a next generation of high needs kids by providing this more enhanced foster home placement treatment experience. Other ways that Texas has supported the goals of FSPSA is our state leadership has been very supportive of the use of kinship placement, and I think it's commonly accepted in Texas that we all know that kids are better placed, better served, have better outcomes in the long run when they're placed with their kin caregivers. So in Texas, we've had kinship development workers for some time. They provide support, wrap around, make sure that kin caregivers have what they need to be successful with the children that they're caring for. Additionally, our kin caregivers are awarded a monthly stipend. It is half the amount of the regular foster care payment, but it's an important stipend to provide support to those families that they take in their kin caregivers. And we've heard from our kin caregivers how meaningful that has been to them. Kin caregivers also have the option to become verified foster homes, and that has been in place for a long time. And it is a slow growing number, but it is a steadily growing number. We are seeing more kin caregivers take advantage of the opportunity to become verified foster homes. And then, of course, kin caregivers have access to other supports in our state, including SNAP and Medicaid and TANF. Additional ways that we've supported the goals of FSPSA is that we have always served families whose children are at imminent risk of foster care through our family-based safety services stage of service. We offer parents parenting skill training. We get that through community resources. We also utilize our purchase client service dollars that for mental health and substance abuse services. Our clients are a priority population through the Department of State Health Services Substance Abuse Service Program. So these are things that we have been offering to parents, and we have been offering them not just to parents whose children have been removed, but also to parents whose children are at risk in order to provide them the support they need to keep their children safely at home. And lastly, you'll notice, of course, Senate Bill 11 during the 85th regular session established the pilot I mentioned earlier for FPSS. And one of the requirements of the pilot was that an evidence-informed service be established as the intervention. And as I mentioned, in El Paso, they're using the Nurturing Parent Program. So that tells you what FSPSA is and what we as a state have already been doing, both ourselves as the Child Welfare Agency and our service providers out across the state. Tells us the things that we already are doing that move us in that same direction towards those same goals that FSPSA envisions. So what does that mean for Texas? And what's next? So we are going to use this interim session to study and develop all of the implementation options and the potential costs for FSPSA in order to inform the 87th legislature. As I mentioned earlier, both Senate Bill 355 and Senate Bill 781 require strategic plans, analysis, and recommendations. and we will be building that out with the help of our stakeholders across the state over the course of the next year. And this is kind of a list of the activities that we intend to engage in as a child welfare program in order to prepare for FSPSA, in order to prepare the strategic plans, analysis, and recommendations that the legislature has asked of us. We're going to look at the approved evidence-based prevention programs and look at the models, look at the costs associated with those, look at the ones that are being utilized in other states, and try and make a determination about what recommendations we would make in terms of that. Obviously, we are going to do a lot of fiscal analysis associated with the costs and outcomes in those approved congregate care settings. The workshop that I'll be doing at the Alliance will be joined by the accrediting agencies, the JCO, or the Joint Commission, COA, the Council of Accreditation, and one other one, CARF, C-A-R-F. So the three accrediting bodies that exist out there across the state and myself will be coming together to facilitate a discussion with Texas residential treatment providers about accreditation and hear from the residential providers about that. We also, of course, part of our physical analysis will be examining the decline in the percentage of children eligible for Title IV-E benefits as we go forward. That there has been a decline in those in recent years. It's definitely a trend line, and so we anticipate that will continue, but we'll be doing further analysis around that. And one thing I'll say, those 4E eligible children, that is as it pertains only on the congregate care side. In terms of the prevention services, the children that meet those definitions for those services and their families will be able, we would be able to draw down money for those children regardless of their 4E eligibility. Here's just kind of continuing our list. One of the things that we are doing as it associates with Senate Bill 355 is we'll be developing a work group with our single source continuum contractors under the community-based care model and our FSPSA contractor in order to talk about what it would look like to have the prevention services that are associated with FSPSA as a part of the community-based care model. And that's what Senate Bill 355 calls for us to do. And in doing that, we'll also conduct a cost-benefit analysis that goes along with that. So you'll notice the bottom two bullets on this slide are associated with the evaluation of prevention programs as well as the data elements associated with FSPSA. There are two requirements for FSPSA. Once you start accepting federal dollars to pay for the prevention services, and those are associated with the evaluation, ongoing evaluation of the program, as well as the data elements. And so our evaluation and research team and our data reporting team are looking closely at all of those items to determine the effort associated with being in compliance with the Act. You'll see that we intend to evaluate outcomes and the impacts on costs associated with qualified residential treatment providers. We also are looking, it says the workload to implement. I mentioned earlier that there would need to be court hearings when children are placed in the qualified residential treatment placement program. So we want to do some work associated with the impact on that to our judicial system and our caseworkers associated with that additional requirement to have that court involvement on that piece. We want to identify a kinship navigator program that might be something that we could present to our legislature as a viable option for Texas. At this point, I mentioned earlier, there have been no kinship navigator programs approved, but we do have a grant that we received a year ago, well, not quite a year ago, we received it in the fall. We have a grant that we received that's allowing us to do some work around kinship navigator program development with our partners at HHSC. And so we'll continue that work. We will evaluate the potential loss of 4E dollars and the potential effects of implementing FSPSA, and then of course any costs associated with training. So I mentioned this work is already underway. We've been working diligently since the bill passed, and we continue to do work. We worked with the University of Houston to complete a kinship navigator study. One of the requirements of kinship navigator programs is that they partner with their local 211 agencies here in Texas. The HHSC has the contracts for the 211 services that are provided across the state, and we have been working with them. As I mentioned, we received a grant. What we have done with that grant and what we're doing in partnership with HHSC are things that can be one-time things to support the future building of a plan, of a kinship navigator program, should the legislature choose to do that. But there are things like strengthening the 211 infrastructure. We are developing training for the call specialists who are responsible for handling the inquiries that come into the call center. And the objective of that training is really to enhance cultural competency of call specialists who serve kin caregivers, and just kind of a straightforward and practical training on kin caregivers and their needs. It's an overview on kinship caregivers, adverse childhood experiences, and trauma-informed care. So it'll just kind of give them a more nuanced background on serving kin caregivers through the 211 line. And we also are working with them to develop a targeted marketing campaign for kinship caregivers. So we're really excited about the work we've been doing there. We, as I mentioned earlier, we're working with Casey Family Programs and the Center for Child and Family Studies at the Alliance to survey the current landscape of prevention services. We sent a electronic survey across the state to all the mental health and substance abuse providers who contract with HHSC or with the FPS. We also sent the survey to all of the entities out there across the state who are providing parenting training, parenting classes, parenting coaching, any of those types of things. We have received over 400 responses from across the state, and our analysis of those responses is underway. But the purpose of the study was really to figure out what's happening out there across the state and what incentives might be needed to move us in a new direction. So we will anticipate that it'll take us till early spring to kind of really have a robust analysis of the study. I mentioned we have made the application for the NEEDS grant, and our stakeholder engagement strategy has started. We really recognize the importance of engaging our stakeholders and the broader child welfare community as we move forward in developing strategies associated with FSPSA. We think it's critical to developing and implementing a successful plan. Our plan is designed to help us understand the desires and needs of our stakeholders, the resources needed by the broader community to successfully implement FSPSA, and to find opportunities to leverage the work that's already underway. We intend to engage with those who are involved in the work and those who will be affected by the changes to our system. So, for example, I think we're going to engage with about 4 different types of stakeholder groups. First, we will engage with formal existing groups of external stakeholders. And most important amongst those are the people who a change in the child welfare system most impacts in the people that we serve. So we will engage with our DSPS Youth Leadership Council, our DSPS Parent Collaboration Group, and our statewide Kin Care Collaborative. We'll also engage with other formal existing groups of external stakeholders, including our DSPS Council, the Texas Behavioral Health Advisory Committee, the Association for Substance Abuse Providers, the Child Protection Roundtable, just formal existing groups of stakeholders that are already out there whose lives will be impacted and who should give us input on how we move forward. We'll also engage with working committees or work groups of which DFPS is already a member, things like the public-private partnership which guides community-based care. We'll, of course, engage the Committee for Advancing Residential Practices, that's CARP, and those folks are residential providers who take care of our kids every day out there across the state, so we want to engage them. There's a couple of work groups. We have a work group that folks from DFPS, HHSC, and the DSHS, the State Health Services Agency, are all a part of. It's associated with substance abuse services in the state, and so we'll be working with our partners on that work group. So we'll be looking at existing work groups who already touch this and who will be impacted by Family First and who are experts at delivering these types of services. We'll engage existing stakeholder groups like the judiciary, residential providers, CASA, and as I mentioned previously, our CBC contractors. And then we will have some informal ad hoc work groups, for example, things like getting our financial team together with the HHSC folks financial team. We've started those conversations. So just informal ad hoc work groups that will help us make our strategic plans, our assessments, our analysis, and our recommendations to the legislature. As I mentioned, I'll be at the Alliance coming up. I've already got a meeting with the CASA, a group of CASA executive directors scheduled for next month. And Belinda Bolton, who introduced and kicked off this webinar, will be getting in touch with folks as we move forward to schedule meetings. We anticipate, that we'll be actively engaging our stakeholder community with the aim to produce our report next summer. So that will be ongoing work. It will just be infused in everything we do. FSPSA and community-based care are really big changes for the state, and it really affects all parts of the child welfare system. So we will just be actively engaged in all the work that we do, trying to figure out how these things fit in with the direction that Texas is already taking, and what recommendations we would make for the future. So, as I mentioned, I just talked about our stakeholder engagement strategy, and I mentioned earlier that we have an action plan. We're still vetting those, but we hope that we will get them up on our website soon. We also have had the opportunity to attend and participate in many national phone calls and in-face meetings with our peers across the country to learn what they're doing, to hear what problems they've identified, to strategize with them, and we will continue to engage in those activities. We, of course, there's a small group of states out across the country, gotten smaller as time has gone by. I think there's about 10 states who believe they will be going live on October 1st, which is just coming up here soon. So we'll, of course, be watching closely as people implement at the early adopters, you might want to say, and learn from them as well. So those are great opportunities for us. We'll continue to take advantage of them. Casey Family Programs has really done a tremendous job of keeping the child welfare community in touch with each other, engaged, and problem solving as we move forward under FSPSA. We have a website that you can see right there on your screen. And we have not sent out just a lot of updates over our website, but you can sign up for our email list. And of course, as we undertake this broader child welfare community engagement, and as we are developing surveys and gathering input and going out there across the state, you'll start seeing more updates from us associated with the email list that you can sign up for on our webpage. And I think now that is it for the formal presentation. I am happy to take questions, and it looks like we have a few. So let me get a little closer to where the questions are so I can see what they are.
How can we access a list of the approved interventions you mentioned? Will there be changes in the procurements and contracts so that providers without other payment methods can implement nurturing parenting program as designed?
Right. So we are going to post a list I mentioned of the currently approved services and programs. We also on that same document will post the ones that are currently under review, of which I think there are about 2021. Hearing the question about procurement, I mean, I think that's one of the things that we're trying to do with our survey right now is take stock of where we are today, what interventions are we using today. The state will have an opportunity to submit interventions to the feds for approval. So that's really kind of our first place. First thing is to really understand what's happening right now across the state, and then make some decisions about what we might want to see the future look like. So that's a kind of a stay tuned one, a work in progress. We're just in our preliminary analysis on that.
Do you have any updates about the Family First Transition and Support Act currently in the Senate that would affect the income test for Title IV?
I do not. I haven't heard any word on it. There was a kind of flurry of information when it first got filed, but I have not heard anything since then. It is an act that actually acknowledges the upfront cost to the state for some of this transition, and is seeking to provide support as states make this transition to Family First. But I have not heard about the bill lately, so I don't know that there's been any activity on it.
Will we be engaging Medicaid and managed care in our work group?
We will. We plan to, we already are engaged with HHSC, but we do plan on engaging with the Behavioral Health Advisory Committee and the other associated HHSC work groups if they want to be involved with us. But yes, and as I mentioned, HHSC, which is the managed care contractor for the state, or they hold the contract, we are engaged with them around this work. They're a very important partner to us.
Somebody would like to know more about the TACFS survey of prevention programs and when or what parts of those survey results will be available.
So the survey was sent out, I can think about exactly when it's sent out. We sent it out and it was out there for 30 days. And we just closed the survey down here in the last few weeks. And the preliminary analysis has begun. We're actually having our first meeting to sit down with Casey and the center to hear the preliminary overview, and then there will be work done to pull that together in a report. But I anticipate that will be released in the spring of this coming year.
Will the state be submitting programs for review on a rolling basis or as a whole after the strategic plan is developed?
I don't know if I know the answer to that yet. I guess it depends on what we think we need to submit. I mean, I think if we had an idea, we would submit everything we knew to be considered, and then that wouldn't preclude us from submitting things subsequent to that.
Do you anticipate a drop in removals when FSPSA is implemented in Texas?
I do not know.
And then we did have a question. Somebody wanted.
And I want to underscore that. I mean, it is one of the important goals of the bill. That is, why I did include that information on Texas, having a significantly lower than the national average removal rate. It's hard to know how this will impact it as compared to other states. And I think, as I mentioned, some states will go live soon here, and we'll be fortunate to have the experience to see how it impacts those states, and that might allow us to make more informed hypothesis on what could happen here in Texas.
And then one final question. Somebody asked, for clarification on what the acronym NEICE stands for.
I do know this. It's the National Electronic Interstate Compact Exchange. Thank you. National Electronic Interstate Compact Exchange.
Excellent. Okay. Well, let's see. That looks like we had several questions about accessing this webinar after we're done today, and I'm about to give you that information. So that looks like all of the other questions. So thank you, everybody, for your participation. Thank you, Christine, for a really informative presentation. So we record and archive all of our stakeholder webinars. And the easiest way to find them is to go to our public website, dfps.state.tx.us, and in the search box at the top, type in CPS Stakeholder Webinar. And it'll take you to the page where this webinar will be archived and where all of our previous webinars can be found. And there's also the information there for signing up for updates and getting information about registering for future webinars. So thank you all very much, and I think that concludes today's presentation.
Thank you.
Thank you, everybody.